Okay, we're going to talk about skeletal injuries. Has anyone ever broken a bone or dislocated anything, or
Yeah,
you have?
my arm.
You broken your arm, and was there anyone around that knew what they were doing for first aid wise?
No, not really.
No. Well, by the end of this unit, you are going to be able to know the signs and symptoms and the treatments for skeletal injuries. So we'll start off with fractures. If you look up to the screen here, you have a closed fracture. That's when a bone breaks and it stays inside the skin. You have an open fracture. It's when a bone breaks and the bone breaks out through the skin. Like the name suggests, it opens the skin. You have a complicated fracture. Complicated fracture is when a bone is broken more than once. It might be broken once with a chip off it, or more than twice. Just anytime more than once, you have a complicated fracture. You have a green stick fracture. Many happens with children because their bones are that bit more flexible than adults. It's when a bone breaks and it doesn't break all the way through. Again, the name comes from what you would imagine if you're breaking a green stick and it doesn't break all the way through. The signs and symptoms of fractures are swelling or bruising, pain at or near the site of the injury, loss of movement, irregularity in the line of the bone, numbness and nerve damage, tenderness at the site of the injury, and shock due to blood loss and pain. The treatment for a fracture is you should always move it under control. You should move a fracture if it's obstructing circulation, or if you need to put a splint on it, purely because without circulation the limb won't last for very long. You should always tell the patient if you're going to move an injured limb, and you tell me why you might do that. Well, if you move and you don't tell him, you might get a punch, for one, and you might inflict more pain than is necessary. You should stop any movement if you are increasing the pain, or if you feel resistance, or if you hear grazing. So some of the risks of uncontrolled movement are you can make a closed fracture open, you can increase the swelling and bleeding, and the nerves, you can damage the nerves and tissue being damaged. You can also prolong healing time. Okay, just to make sure you weren't asleep there, I'm going to ask you, if a bone is broken and it pokes out through the skin, what do you call that? Open, that's right, well done. And if a bone is broken more than once, what would you call it? A complicated fracture, that's right. And what fracture is mainly happens in children's bones? Is there another one there? There's anyone? A closed fracture. Okay, that's well done. We'll move on now to dislocation. Dislocation is when a bone is normally part of a joint, it becomes out of place. You see up here a normal functioning shoulder, and on the right where the bone has popped out of its socket, it's a dislocated shoulder. The signs and symptoms of a dislocation are pain at the site of the injury, loss of motion in the joint, deformity, so it's not going to look like it normally does. You may have no pulse or numbness or paralysis below the injury. The treatment for a dislocation is rest, so you're going to try and not move it. You're going to ask your patient not to move it. Ice to keep the swelling down. You're going to control the movement. Controlling the movement by putting a sling on if it's a shoulder, which is most common in adults, and or a splint in an elbow, which is the most common for a child to dislocate, do not try and put the bone back into place. Okay, so just to make sure you're paying attention, a dislocation is a bone that is, you help me out there? Out of place, that's right, well done. We'll move on to strains and sprains. Strains and sprains, we have them together because the signs and symptoms are the same and the treatment is the same. A strain is when a muscle is overworked or overstretched, and a sprain is when a ligament is torn or overstretched. The signs and symptoms are swelling, bruising, pain increases on the movement of a sprain, tenderness, and cramp. The treatment for this is rice. Not Uncle Ben's rice, but the R stands for rest, I stands for ice, C stands for compression, and E stands for elevation. Okay, so then just back on that again, I'll go over the R is rest, so you're going to ask the person not to move it. Ice, keep swelling down. Compression, to control the movement, and elevation to keep the blood flow away from the site of the injury. Okay, oops. We're going to move on to spinal injuries. The most important thing about spinal injuries, never attempt to move somebody if you suspect they have a spinal injury, other than the only exception is if you're protecting their airway. If a patient is suffering from loss of feeling, paralysis, or numbness in any of their limbs, you can suspect that they have a spinal injury. The signs and symptoms of a spinal injury are deformity of the spine, difficult or laboured breathing with minimal movement. So it's going to be obvious that they're having difficulty breathing, but the movement of the chest cavity is going to be a little rising and falling. They may have paralysis or their arms or legs or both. They have loss of feeling of weakness, tingling and numbness in their arms or legs. They will have a burning sensation along the spine as well. If the patient is unconscious and their arms are in an unnatural position, like as if their arms are outstretched above their head or curled into their chest, you can assume they have a spinal injury. If someone falls, generally your arms will fall to your sides, not up into an unnatural position. Okay, the treatment is different for both unconscious and conscious patients, purely because you can ask a conscious patient some questions and they can answer you. An unconscious patient, you have to do a bit more detective work. So we'll start off with the treatment for an unconscious patient. You call an ambulance. Ask people who may have seen what happened. If you didn't see yourself, ask someone around. You might be able to determine what the injury may be. Look and feel for deformities of the spine, and see if your patient responds to pain. So you give a pinch to the hands or feet. Give a good hard pinch, and because you want to get a reaction. For the conscious patient, we're going to ask the patient if their arms or legs feel numb. Asking the patient, feel you touch their hands or feet. You're going to ask the patient to squeeze your hand or to push your hand away with their foot. Look and feel for deformities or other injuries. That's skeletal injuries. That's spinal injuries. And just going one question for you on spinal injuries. What must you not do if you suspect someone to have a spinal injury? Don't move them unless you are protecting their airway. That's well done. Any questions? Thanks very much.